So I bring in all the wishes and greetings from Speed Medical Institute on behalf of all the faculty members to Dr. Arshdeep Singh for scoring CML rank number 1 and AML rank number 3 in ini-cet session April 2023 in the specialty of DM Cardiac Anesthesia.
Thank you so much, sir.
So really wonderful to interact with you today. And can we know from you from where you have started?
Sir, see, actually, I just completed my MD last year and I had given the November aims also. But November aims I had given without any coaching. So I did not have any success in that. Then I joined post that November aims. I came to know about Speed, and Speed was the only platform which was providing coaching for cardiac anesthesia. So I came to know about Speed and I joined it in December. I took a 6-month subscription and then my journey started from there and I started doing all the videos and all the question banks from there. The videos of particularly Dr. Akhilan and cardiac anesthesia by Dr. Vijita was very helpful for me. So, and by just listening to the videos, and the videos were so conceptual that I did not have to read any other textbooks also. So all I did, since it was only a 4-5 months, in November I gave and it was again in April. So I did not have time to read books again and again. So I just read the notes. I viewed the videos, the conceptual videos. I viewed them twice or even thrice, and I did the question banks also 2 times. And the best thing that the explanation of all those questions was from all the standard textbooks. So I did not have to read them, and it was really a great bit of help from Speed that it helped me to achieve this rank.
Doctor, where you did your UG and PG from?
Sir, both from Government Medical College, Amritsar, sir.
Great. So, I mean, when you are doing MD anesthesia and your interest towards DM for cardiac, how it started?
Sir, actually, the thing is, in our college, there was no super specialities. So all we did in anesthesia was mainly a bit of general anesthesia and regional. That's it. So there was no neuro and there was no cardiac. So what actually started, like in our institute, whenever there was any cardiac case, like a patient with a low ejection fraction or any cardiac cases like triple vessel diseases, so the patient was always referred to some other institute. So there was a zeal in me to get those patients operated, like to get patients operated for cardiac surgeries or even cardiac patients with very high risk cases. So, that was the zeal in me that I always wanted to get those cases done in my institute also. So that's why I wanted to DM cardiac anesthesia so that I can get all the high risk cardiac cases and the cardiac surgeries as well done in my institute only.
Now, after you finish your cardiac anesthesia, are you going to open a unit for that, or how is that going to happen?
Sir, actually, the thing is, my head of department is very supportive of it. She's also like very much into academics, and she wants that everything should be here only. So I would like to, even after joining cardiac, after completing my cardiac, I would like to come back to my own institute and I would like to do something for it. Since it is my alma mater, I have done both MBBS and MD from it only. That's why, sir.
8.5 years, almost 9 years in the same place.
Yes, sir. Yes, sir. Yes,
One
sir.
decade.
Exactly, sir.
Right. So very, very nice to interact with you. Then how you got into Speed? I mean, who recommended you to do so?
Sir, actually, from anesthesia, not most of my seniors were doing super specialty, but my friends from other branches like medicine and surgery, they were taking coaching from Speed. So some of my seniors who, one of them is in JIPMA, he got rank 3 last year, I think. So he also took coaching from Speed and I was like asking because I wasn't getting a lot of platforms to study. So I asked him that from where did you study when he got such a good rank? So he advised me that you can take Speed only. That is the only platform that will provide you good coaching for super specialties.
Very nice, very nice. Now, what is the message that you want to give to students who are aspiring for it? aspiring for a DM, any specialty in anesthesia, and also for cardiac anesthesia.
So, I would like to give only one message that, see, in anesthesia, most of the people in anesthesia don't go for super specialty. But what I think that one should do super specialization, because you have to become the master of the subject. Okay? By doing only general anesthesia, you can become a jack of all trade but master of none. So by doing a super specialization in a thing, even if you want to do in neuro anesthesia and organ transplantation or cardiac anesthesia, at least become the best in one thing, and that's it, sir.
Very nice. Now, was your primary exam ini-cet exam or a NEET exam? I mean, I think it will be anyway. I'll get to know from you.
Sir, I got rank 34 in NEET last year. So except Delhi colleges, I was getting everywhere. But my main focus was to get in a central institute like AIMS Delhi or PGI Chandigarh. So even when everyone was asking that why you dropping after such a good rank, but I know that I can do it. So that's why I dropped and I targeted for any, and I took the coaching also, and that really paid off, sir.
So without coaching, you're able to achieve, and you tried. Why can't I have a coaching and try once more?
Exactly.
So now, is your department now very happy now?
Very happy.
So
Congratulations are pouring from everywhere.
Very nice, very nice. And I mean, what are your parents saying? What are they? I mean, now feeling about it?
Sir, they are also very, very happy. Actually, the thing is, my parents were not able to actually take it in that I got first rank in CML. When I told them the first time that I got rank 1, there was no reaction from them. For first 2-3 hours, there was no reaction. So it took them like a good couple of hours to soak it in that I have got such a good rank, and they were like totally freaked out about it. Like, how did it happen?
So how many questions did you attempt?
Sir, out of 80 questions, I attempted 76.
Maximum numbers.
Yes, sir.
So I think you are a highly a positive vibe person. I mean, I think you make people always happy around you, I believe, because that's what I get.
Yes, sir, I try to.
Lot of positivity. And generally, anesthetists will not talk much actually, because to my experience, they will be to the point. Because when they talk too much, then we'll ask more cases for them to do.
Actually, I'm happy to get all the cases done.
That's what I'm saying. So they'll not give more space to the point. The question asked, to the point is the answer.
Yes, sir.
Yes. And now it's a time for you to thank whom all you want to thank. You can take your time to this platform, and this will reach, for people whom you want to thank. And you can, with the names, you can do so.
So actually, first of all, I want to thank my head of department, sir. So actually, most of, just like I said, most of the anesthesia, even my co-PGs, like they do not opt for super specialty, but she was the one like who always believed and always pushed me to do something. She's like, you can do it, study further. You're very young, go for it. So my HOD, Dr. Veena Chatrat, she's like the most supportive person. Then, sir, my brother and my father and my mother, they were also very supportive. And next is my fiance. Actually, the thing is, when I got like NEET rank 34, my parents pushed me like, take it. You won't get it next time. So he told me, I know you can do better. You can take a drop. So I took a risk and I did it. So I want to thank all my teachers, sir. Most importantly, all my teachers who always believed in me, sir. And next, most importantly, Speed who helped me achieved it.
Very, very nice, doctor. Great interacting with you. Once again, we wish you all the best and all the success for a great career and DM cardiac anesthesia. And definitely you will be very helpful to take care of the patients when posted under this, because such a very important specialty for cardiac surgeons.
Yes,
and,
sir.
and you will definitely do great to them. And I wish you all the best and all the success, doctor.
Thank you so much, sir. Thank you, sir. Okay, sir.